Prostate cancer is the uncontrolled growth of abnormal cells in the prostate gland. The prostate gland is located just below the bladder. It is one of the most common cancer in males. When prostate cancer starts early, that early stage prostate cancer, you may not necessarily see much symptoms. But as now begins to progress, symptoms begin to appear. You can see things like frequent urination. Then there's a difficulty in starting to urinate. Then sometimes the flow is weak. You can also have interrupted flow. Some people also have blood in the urine or blood in the semen. Some other people can have low back pain, can also have pain in the hips, then in the upper thighs, especially when it begins to spread to the bones. The last but not the least is some form of erectile dysfunction. Yeah, the exact causes of prostate cancer may not be known, but there are certain factors that increase the likelihood of one getting prostate cancer. Age is a very important factor. It is said that as you get older, the chances of you having prostate cancer is also increased. Then in the black race, people of African descent in any part of the world also have been found to have an increased risk of developing prostate cancer. When there's a family history of prostate cancer, the likelihood of the people in the family having prostate cancer also increases. There's also an associated factor when genetics are involved. When there's prostate cancer, the chances of the females having breast cancer and ovarian cancer has been found to also be increased. Early growths do not produce symptoms. Screening is of utmost importance. There are two main screening tools that are used. They are what we call PSA, prostate specific antigen. It's a blood test. When the levels are high, it may suggest that there may be some form of proliferation of cells, that's cancer going on. So when it's high, further tests will now need to be done to know if the person has a prostate cancer. They are what we call digital rectal examination. That's the doctor examines the patient digitally from the rectum. The fingers can easily have access to the prostate, and the consistency and structure will determine whether there is a need for further investigation to make a diagnosis of prostate cancer. A lot of factors determine how the treatment option should go. There's what we call staging, grading of the disease by the clinician. And also the aggressiveness of the cancer will determine the treatment options in this case. Now, there's what we call active surveillance. That is also known as watchful waiting. If the cancer is slowly growing and there are no symptoms, there is no reason for any form of treatment at that point. The patient may be coming in from time to time for checks to know how aggressive, to know whether it's growing rapidly or not. If it's still slowly growing, the patient will be coming in for checks maybe on a 6-monthly basis. And if the parameters still remain the same, then we'll continue to watch like that until there is a need for some form of intervention. In this case, like localized treatment. Localized treatment now will involve surgery, that's a prostatectomy, to remove the prostate gland. Then some form of radiation also to kill the cancerous cells in this case. Like I said earlier, it depends on when the patient presents, how the patient has come. When the patient comes, that's the stage at which the patient comes to the hospital. That will not determine the treatment options. Of course, if the patient comes when it has spread, then the mode of treatment will differ. It will not be, there won't be any watchful waiting. There are also what we call systemic therapies, some form of hormone therapy, then chemotherapy, then certain targeted therapies, especially when the cancer has spread. You target the areas where the cancer has spread in order to reduce the effect of the cancer and kill those cancer cells that have spread. Benign prostatic hyperplasia, also known as BPH, is a non-cancerous enlargement of the prostate gland, as opposed to prostate cancer that is cancerous. For BPH, the prostate also enlarges and now squeezes the urethra. That's where the urine passes, because the urethra passes through the prostate. So when it squeezes it, it now affects urine flow. With that, there are now problems with passing out urine. The bladder fills up, there will be a backflow to where the kidneys are, and further problems now ensue because of that. For risk factors of BPH is rarely occurs before the age of 40. But as one gets older, for those that have the propensity, that's the likelihood of developing it, it begins to manifest. A family history of prostate problems also predisposes certain people to having prostate enlargement. Then certain health conditions like obesity, type 2 diabetes, erectile dysfunction, and certain heart conditions have also been found to be associated. That will be all for this week. Till next week, when we'll continue to address your health and fertility concerns.